what I would like to do now, if it's okay with everyone, and even if it's not, I would like to make a few comments regarding our American healthcare system. And I'm speaking primarily to physicians, and I'm going to deal with this by trying to deal with 4 simple questions. The questions are, where are we? How do we get here? Where do we want to go? And how do we get there from here? So where are we? When young doctors become admitted to medical school, their minds are not usually filled with the desires to become expert business managers and ways to get rich quick. On the contrary, their minds are usually preoccupied with thoughts of becoming outstanding physicians. This falls throughout most areas of training. Medical school and residential training programs rarely include business courses teaching student doctors how to manage business side of a medical career. Medical school and specialty training also cultivates a culture of individualism and competitiveness that dominates the rest of their careers. It does not take much imagination to understand how business of managing medicine fell largely into the hands of non-physicians. Physician medical business managers are the exception rather than the rule. Medical business managers have created and operationalized medical and surgical business models that we have today. And physicians are complaining a lot. We were not invited to the meetings where those models were created. The process of providing the care as well as the income derived from such care has often been the subject of physician complaints. Putting it simply, physicians often find themselves working very hard but practicing below their desired quality of standards while being paid less than what they think they deserve. Not surprisingly, we are in an age where physician component of the healthcare dollar expenditure is down to about 16%, I understand. This is from 30 years ago when it was about 30%. More importantly, there's a sense that patients are too often not getting the quality of care that their physicians desire for them to have. Now, how do we get here? Physicians, in general, never really wanted to be businessmen and women and found it easier to accept getting paid by services provided by third-party payers. The federal government became a major third-party payer along with numerous private and medical insurance companies. As the cost of health care creeped upward, the payers decided that they were paying too much for this health care. One of the easiest cost centers to identify, guess what, is the cost of physician services. Medicare and eventually Medicaid took the lead for decreasing health care costs by limiting payments to physician services. Simply stated, the government, Medicare, Medicaid, offered physicians the opportunity to treat patients, charge the government instead of the patient, and everybody would be happy, right? However, physicians who participated would have to accept the standard fee for their services. This fee would be determined, of course, unilaterally by the government. This idea seemed to work relatively well in spite of considerable controversy at first and ill feeling amongst some physicians regarding government intrusions into health care, and specifically the unilateral fee-setting part of this process, which extremely resemble a take-it-or-leave-it sort of an environment. There's one more factor that should be noted here that is extremely important. That is, physician training unintentionally conditioned physicians to be highly competitive in everything and to be cooperative only as a last resort. Enough astute physicians embraced the Medicare, Medicaid, and plans and did quite well. Others did not bother with this, and they did okay too. Other third-party payers saw what the federal government could do, and so they decided it worked for the government, it worked for us, so we have a model. The fact that physicians compete far more often than they cooperate with each other gave the insurance companies and the other stakeholders in healthcare, hospitals, a major advantage over physicians. Ironically, physicians are the essential component of any successful healthcare system, but often find themselves reacting rather than leading the evolution of healthcare in America. In addition, in determining physician fees, third-party payers were eventually able to dictate what acceptable care was and what was not by paying for the one and not the other. They defined acceptable physician practices sufficient to approve payment for billed physician services based on the likings of the insurance companies. To be a preferred provider, physician has to practice by the rules of the payer. The payer, in my world, is always the boss. The problem was, and still is, that practicing doctors or preferred providers did not have and still do not have a sufficient voice in making the rules. This plays out in many arenas. For example, who determines who's a good doctor and who's a bad doctor? Who makes the criteria of such determinations? One of my best examples is the following. Malpractice insurance carriers charge significantly higher rates for doctors who perform risky, complex surgical cases than for those who do not. This is a very bad thing if you happen to be a patient needing complex surgical procedures and cannot find a nearby surgeon capable or willing to perform the procedure even if they could because of the higher malpractice premiums. I think you're getting a glimpse into what picture I'm trying to paint. Physicians have largely lost their voice, influence, and presence at the table where healthcare policy dynamics are being created. This is true at every level of the business of medicine, including government, hospitals, insurance companies, multi-specialty clinics, and so forth. This has to change if healthcare in Hawaii, and indeed America, is to change for the better. Now, where do we want to go? Since in the public eye, physicians still are the symbol of the American healthcare system, we need our seat back at the table that determines what American healthcare looks like in the future. As a physician, I've worked as an active duty military physician, a health maintenance organization corporate employed physician, a private practice solo physician, as Dr. McCaffrey alluded to, and now as a federal contract physician. Probably the best job I ever had. Each of these positions required me to be knowledgeable about the business of medicine. In each of those roles, I saw that physicians needed a better seat at the table. The corporate system that I worked in seemed to have the best seat at the table of all those circumstances I worked, but still was not nearly good enough. As a corporate physician, I declined requests of my colleagues on 2 occasions to seek the office of medical director for our doctors group. The reason is that it would have required sacrificing my true professional love of being in the clinic and taking care of patients in the operating room. It would also have put me at an even greater professional and personal risk than I already was in because I am such a strong patient and physician advocate. The two naturally go hand in hand, but ironically, in this day and age, being a strong patient and physician advocate can be hazardous to a physician's professional health. My message to all physicians is to be careful how you rock the boat. It can be risky, and I'm telling you that from personal experience. There's a constant tension between the quality of care and the rise in healthcare cost. I firmly believe that the best as well as the cheapest way to take care of patients is to provide the best possible care the first time around. Physicians need to help determine what the best possible quality of care looks like. Physicians need a practice environment where they can provide the kind of care for their patients that they would accept for themselves and for their own families. It is getting harder and harder to find those places in the average American community. As physicians, we have to find a way to make more of those places right here at home. Why, you might ask? As physicians, regardless of whether we are providers or administrators, we or our family members, friends, and colleagues, like you out there, will eventually consume what we create. Now, how do we get there? As physicians, we have to cooperate more than we compete with each other. In Hawaii and across the nation, we have so many different physician organizations. I currently pay membership dues to about 6 organizations myself. Why do we need so many? Maybe the reason is that no single organization truly represents our individual competing interests. Some of the organizations I belong to are clearly duplicitous. What I'm trying to emphasize here is the presence amongst physicians of the naturally occurring divide and conquer dynamic that works against us in playing our essential role as necessary to help healthcare industry create a healthy American healthcare system. Seeking to become an employed corporate doctor is a trend that is gaining more and more momentum. Private practice is commonly assumed to be a dinosaur model practice. I cannot judge as to whether the trends are good or bad, but I know that things are changing and the impact on physicians on those changes is insufficient. More often than not, I think that the priority of the business of medicine is to cut costs and increase profitability. That's important. But it needs to be done more in a situation where we create a system with the highest quality of care and access in a cost-effective way. How do we begin to change to this in Honolulu? We need a stronger and more influential Honolulu County Medical Society with membership that boasts the vast majority of our physicians living and working in the county, inclusive of all specialties as well as physician administrators. The same is true for all of our county components of the Hawaii Medical Association and, of course, for the American Medical Association itself. Until we can make this happen, all of our complaints and discussions amongst ourselves are meaningless. Increasing the membership of the Honolulu County Medical Society is one thing we can do and get started on now. But even this is just a start. We need to collaboratively create an American healthcare system that is truly representative of the great country that the United States of America truly is. Let's get to work. Thank you.